We just had, as I mentioned, a very productive meeting. Let me go back here, sorry. With Val, and had a lot of conversations about just the value of data sharing and how this relates to kind of the mission of the department and so forth. And Val gets our value. I think it's very clear that you understand what this means and what data sharing means, and we're grateful for that. We're actually talking about ways to work together on a variety of things, but what I wanted to say with this particular program with PA Navigate, it is, and I'm going to use the term, and maybe it gets overused. I know Val has used this a couple, but it's so true. It's game changing, right? This is absolutely game changing. This capability. We're happy to be a part of it. We think we're a critical part of it, but very happy to be part of this in some way. In fact, when we, the team, first thought about this idea about having this session, and this was back, and I looked at it actually this morning, Val, you may remember this, February 18th, it was a Sunday at 10:48 in the morning. I actually sent the message to Val to say, would you even be willing to be a keynote? And I counted this morning, within 10 minutes, under 10 minutes, she responded to that email and said, absolutely, I will be there. So that gives you a sense of her commitment behind this, but also the state's commitment behind this. So we're very proud and honored to have her here to help kick this off. So please join me in welcoming Secretary Arkoosh to this.
So, Marty, thank you so much for that very, very kind introduction. And you must have just gotten me on the right Sunday when I was, I don't know what I was doing, but I appreciated the invitation. So it's really great to be here. And I also want to thank Bill Morella, Vice President for Value-Based Purchasing at HealthShare Exchange, all the rest of the HealthShare Exchange team. You all are doing really great work in pursuit of better clinical experiences for both providers and patients. And, really focusing on great outcomes for our patients across the Commonwealth. It's so important. We're really grateful for the Pennsylvania Patient Provider Network and the work that the HIE Exchange Coalition is doing. It's creating some incredible opportunities for us here in the Commonwealth. So this work is a part of our healthcare system that people don't always see and patients may not be aware of. But alongside our eHealth office, the PA Health Information Exchange Coalition works every day to form those bridges between health systems and provider networks, and now with PA Navigate, our community-based organizations, to make sure that these different organizations are working together and that we can understand comprehensively the ways that patients are interacting with different parts of our healthcare system. We really have the opportunity now for a window into this work that we've never had before. And this knowledge is essential to making the whole person approach to healthcare that is vital to success and make better health outcomes a real possibility. And believe me, I know this firsthand. I came into public service by way of practicing medicine. I practiced medicine here in Philadelphia for a little over 20 years. I'm an anesthesiologist that specialized in obstetrics, so I spent a lot of time on the labor and delivery floor. And I saw the health of my patients impacted, really every day by issues that extended way beyond the exam room. I can say with certainty that I would not be standing here with all of you today if it were not for my time practicing medicine, both what I was able to treat, but in some ways more importantly, the things I could not treat as a doctor. And one story that I like to share to illustrate that is about a pregnant woman that I met when she was about 8 months pregnant. And she had just been diagnosed with very severe diabetes during her pregnancy. And she was very close to term, so they put her on the labor floor just in case she went into labor. And so I was meeting her and getting her history in case she did go into labor. And we started to talk about her diagnosis of diabetes and how she was going to handle things once she went home. And she just looked at me and she said, "Doc, I have 2 other children. I have a 3-year-old and a 5-year-old, and I, belly out to here, 8 months pregnant." And she said, "I have to take 2 buses to get to a grocery store that sells fresh fruit and fresh vegetables." And that really kind of knocked me over the head. You know, as someone who had been fortunate enough to never worry about how I was going to get to a grocery store, I realized that this wonderful person in front of me, who was in one of the finest medical institutions in the United States, being cared for with doctors with just incredible training and experience, the minute she walked out the door of the hospital, all bets were off. Because what she needed was a grocery store, and I couldn't prescribe a grocery store. There was no way. I didn't have that tool in my toolbox. And as physicians, we're always thinking about how to solve that challenge right in front of us. But when it came to that patient, I knew I had to start to think about how to solve some of these problems differently. Sometimes before we can get ahead, we do have to focus on that crisis in that moment, you know, that very urgent problem right in front of us, and help that person get stabilized and move forward. But we have to also pause and look at the bigger picture and think about where are there opportunities where we can intervene to not only make the challenge that someone like my patient was facing a little bit easier, but could we have prevented this in the first place? You know, if this was someone that had had access to healthy food throughout her pregnancy, maybe she wouldn't have developed diabetes during her pregnancy. Maybe it wouldn't have been as severe, even if she had. So it's so important that we meet people where they are and address their most urgent needs. It's a big part of what we do every day at the Department of Human Services, but our work cannot stop there. We must look upstream. So as a physician, I saw patients who, to be healthy, needed so much more than the prescriptions that I could write or the treatments that we could prescribe. They needed access to that fresh, healthy food for both themselves and their families. They needed a safe and secure home. They needed comprehensive behavioral health care. They needed transportation to get to work, reliable and affordable child care or elder care, again, so they could get to work, and so much more. I fundamentally believe that the opportunity to live a vibrant, healthy, and enriching life is something that should not be a privilege based on the zip code that you were born in, your social identity, your economic mobility, or a person's ability to navigate pretty complicated systems of care. I think all of us know that, unfortunately, as much as we might want this equal opportunity, it's really not the society that we live in today. But we can change this. We can make it a little bit easier, but we have to be intentional in our approach to this work. I decided to broaden my focus and be part of the essential work to reduce and eliminate the systemic barriers to good health for my patients and for so many others. The desire for change took me back to school to learn about public health policy and to get a master's in public health. I continued to practice medicine while I was doing that. And then I got more involved in advocacy, something that I learned was so important to getting policy change put into place. So this was in the early days before the Affordable Care Act. I became very involved in an organization called the National Physicians Alliance, and we worked with the Obama administration in the run-up to the ACA. You know, at the time, and I remind you all of this because I think we've all forgotten, on any given day, at the Philly teaching hospitals where I worked over the years, we could have 20, sometimes 25% of my patients did not have health insurance. That was just the norm before the Affordable Care Act. And thankfully that number is much, much smaller now, but it's not zero. So we know that this work can make a difference, but we got to keep at it. We're not done. We can't check that box quite yet. After I got very involved in that advocacy work and policy development work on the ACA, I eventually was appointed and then elected to the Montgomery County Board of Commissioners. And I know Monco is definitely in the house today. It's nice to see some old friends. So, yep. Bill Ryan was at the door. He never misses an opportunity. And so I had just the privilege of serving the folks of Montgomery County for 8 years, including during COVID, which was an adventure in and of itself. And I also had the opportunity to serve with now Governor Shapiro. We were county commissioners together for 2 years before he became the Attorney General. So it's great to have that opportunity of shared experience and shared values and know that we're very much working in the same direction on some of these really critical issues. So I worked as a commissioner until the governor reached out to ask me to assume this role. And I share these stories of my time in medicine and my time in public service and this journey that brought me here to the Department of Human Services because I wouldn't be here without those experiences and what I learned and saw as a physician. And while I don't practice any longer, I just don't have the time, I do approach this work every single day with that medical and public health lens and believe that it's my responsibility to lead through this role in a way that helps our providers and hospitals, whether it's preventive care or acute and specialty care, whether it's physical or behavioral health care, at all levels, have the tools that you need to make that lasting impact on a patient's life in whatever way that patient wants that impact, in whatever way is success for that particular individual. And with PA Navigate, the resource and referral platform that the Health Information Exchange Coalition launched in January with support from the Department of Human Services, we're bringing a tool to providers and to community-based organizations to create that connection, create that synergy across essential services, and fill a huge gap in the ability to help people whose needs extend beyond what is available in the exam room to live that healthy life. Physicians and social workers and others in clinical, nonprofit, and public settings may try to refer people to additional supports. Take the situation I spoke of earlier of my pregnant patient. She had to take so many steps just to get to a grocery store, with her kids, and then, how many groceries do you think she could carry back across 2 buses with 2 little kids, right? So we need to help people like that, just make it a little bit easier for them so it's not impossible for them to be healthy. If we're lucky, we may be familiar with or have pre-existing relationships with helping or support organizations who might be able to assist with some or all of these persons' needs and challenges. But the reality is, more often than not, providers have no idea of where to refer a patient. And so what happens? They just don't ask. No doctor is going to ask a patient about food insecurity if they don't know what to do. If the patient says, yeah, actually, I don't have any way to eat 3 meals a day, and neither do my kids. If you don't say, we have a plan for that, you're not going to ask the question because you don't want to hear the answer. And that is what is so important about PA Navigate. I dreamed of this as a physician, and I dreamed of it as a county commissioner. As we worked, we had a whole office of people in Montgomery County that this is all they do. But they do it by phone and by email, right? And try to connect constituents to the services that they need. PA Navigate will be a game changer, it truly will, in how we do this work. Through PA Navigate, when fully implemented, we'll be able to refer a person to services in their community. Just like a doctor sends a prescription to the drugstore, they'll be able to send a referral to a local community-based organization that Mrs. Smith needs help with some food. We'll be able to track those referrals and better understand and assist with the person's individual needs and help them access the services and supports in a way that is convenient for them, that is easy for them to do. Right now, today, any community member can also look up those resources on their own. Just go to panavigate.com, and they can do a self-referral, introducing themselves to a social service or community-based organization near them, so that these organizations can begin proactive outreach to ensure the person is getting the supports that they were looking for. PA Navigate is the bridge that connects healthcare, social services, helping agencies, and other partners to finally, truly coordinate the person-centered care that we each aspire to deliver. It's okay to have limitations, right? No single healthcare provider or organization can address all of a person's unique needs, but together, this is the key, working together, pooling our resources, finding a way to make it easy to collaborate, we can put and keep a person on a lasting path to good health and a better life. Obviously something we all want, and we all want for the people that we care for. PA Navigate will help us do this by seamlessly enabling that essential communication and collaboration, easing barriers to services that will improve health outcomes and help provide a better quality of life for all Pennsylvanians. The technology providers have available to us now through electronic health records, the PA Patient and Provider Network, and the health information exchanges gives us a better insight into a person's life, health, and history than we've ever had before. This progress is already a game changer, I would argue, and it's time that we continue to build on that process. PA Navigate can be transformational in helping thousands of Pennsylvanians, people served by healthcare and social service and community-based organizations, local, state, and federally operated supports, so these individuals can better connect to the right supports and resources that they need right in their communities. And it's also going to be enormously helpful for us. The data that we'll be able to glean from these systems to really understand where referrals are going, what are those referrals, what is working and what is not, will help us strengthen and build our infrastructure, make sure that we're providing the right services in the right places at the right time that people actually need. We'll have much more insight into how to construct our own budgets with our resources to really aid folks here across our Commonwealth. So PA Navigate will make that intersection and that exchange of information all possible. It's a whole health data platform and a community information exchange, way better than Facebook. This platform is something that Pennsylvania needs and so many people will benefit from. And I'm really excited to see it continue to come to fruition and how it's going to help all of us serve or take care of the people that we are pledged to serve. So these health-related social needs, like stable housing, consistent access to nutritious foods, social supports, a safe community, and more, can shape a person's success in education, in the workplace, and really their health across the lifespan, and their children's health and well-being. Research has found that social determinants of health account for 50% of geographic variations in health outcomes. 50%. And I'm a little sad to say that you know how much clinical care contributes to those geographic variations in health outcomes? 20%. So 50% health-related social needs, 20% clinical. And obviously that clinical is extremely important in the moment, right? If someone has an acute healthcare need, we need to make sure that that system is robust and strong and there for them. But we can now really look beyond that urgent need to the broader causes and stressors that influence people's health. This gives us an opportunity to get ahead of health concerns or make more sustainable interventions upstream. We must not miss these clear opportunities to identify challenges and potential solutions. So PA Navigate is a vehicle for that opportunity. But beyond that work, DHS is continuing to pursue new innovations and opportunities to do more for Pennsylvanians and to put new tools in our toolbox to help people toward better health. Under the Biden administration, the Center for Medicare and Medicaid Services now allows states to tailor their Medicaid programs through a process called an 1115 waiver to use dollars on some of these health-related social needs. We hope to take full advantage of this opportunity to improve the lives of Pennsylvanians and reverse some of these trends that are so detrimental to their health, well-being, and overall quality of life. DHS recently submitted our 1115 waiver application, which we've titled Bridges to Success, Keystones of Health, to the Centers for Medicare and Medicaid Services. You can view the full application at dhs.pa.gov. There's tons of information there if you're interested in learning more about this. Our proposal spans 4 key areas: housing, nutrition and food as medicine, reentry supports, and multi-year continuous coverage for children through age 6. So let me tell you a little bit about each of those buckets. So being safely housed, you all know, can reduce hospitalizations, emergency department visits, and incarceration rates. A study on the impact of housing supports alone on Medicaid spending in Oregon found that housing supports reduced an individual's Medicaid spending by 12 to 16%. To realize a similar impact in Pennsylvania, my team has designed programs to expand housing and tenancy supports, short-term rental assistance, and social and emotional support to help people stay housed and reduce evictions. Food is also obviously extremely important. Data from during the pandemic found that nearly one in four Medicaid households were food insecure, and that women and people of color were more likely to experience food insecurity. Nutritional deficiencies and food insecurity can have a lasting impact on a person's health, their ability to succeed in school and in the workplace, leading to broader societal costs and, of course, obvious health risks. We may be able to slow or prevent these issues by making healthy, nutrient-rich foods more accessible to people who don't have an affordable grocery store with fresh fruits and vegetables readily accessible. DHS is seeking to expand coverage for medically tailored meals, and we're going to hear a lot more from the folks at MANA here in just a minute, and also grocery store deliveries and other nutritional supports for pregnant and postpartum people experiencing food insecurity. Newly diagnosed diabetics and others with health conditions where the proper food is essential to the treatment of their or managing their disease. These are interventions that can help entire families and give children and youth a foundation for healthy growth and healthy habits throughout their lifespans. We're also seeking to better support the health needs of individuals who are returning to their communities after a period of incarceration. Reentry programs can reduce preventable health care use and recidivism. In Pennsylvania, nearly 2/3 of individuals recidivate and cost the Commonwealth $3.1 billion per year in total societal costs. Programs in other states focused on housing alone have led to sharp reductions in violations, in some cases as high as 82%. Rates of overdose death following reentry are extraordinarily and heartbreakingly high. On average, a 12-fold increase risk of death, and even higher in a recent analysis of some data from Philly, 37 times higher in those 2 weeks after leaving the correctional facility compared to a non-incarcerated population. Another recent national study of rural communities in the United States found that among people with substance use disorders, 42% had recently been incarcerated and had much higher overdose death rates. We know that transitions from prisons and jails is a very, very high-risk time, and that individuals face significant barriers to successful reentry. Overdose deaths are more likely when individuals face gaps in care. This reentry program would create a stable bridge of coverage and care from the prison or jail to community treatment programs and help reduce recidivism. And then lastly, we want to encourage regular use of preventive and well-child visits and avoid disruptions in care by providing multi-year continuous health coverage for Medicaid-eligible children through age 6. As you all know, early screenings and interventions and preventive care to address physical, behavioral, developmental, and other health needs leads to better outcomes through adolescence and into adulthood. This investment in uninterrupted access to care for children will have a lifelong impact. If approved by CMS, these initiatives will bolster our work and present an opportunity to broaden the resources that DHS and providers and other partners have available to help Pennsylvanians achieve stability and success. It will bring us some tools to our toolbox that we've never had before, so we're pretty excited about this opportunity. And one of the things that will make this achievable is the fact that PA Navigate already exists, is already up and running. PA Navigate is going to be integral into helping all of us connect those individuals to those health-related social services and really close that loop. You know, that's what PA Navigate is. It is a closed-loop referral system. So the fact that we're this far along, further than any other state in the country, by the way, in terms of a statewide model for this, is really going to make this much, much easier to implement and be successful. So those are just a couple of the things at the top of my list. I could go on for hours, but I will spare you that. But thank you so much for having me here today. We really look forward to continuing to work together. We welcome your ideas and your thoughts and what we can do to help all of you make your work a little bit easier as we all strive to make sure that every Pennsylvanian has that opportunity to be successful, to be healthy, and to thrive in a way that is meaningful and impactful for them. Thank you.